Sleep apnea is a serious sleep disorder in which breathing repeatedly stops and starts during sleep. There are several risk factors that can increase a person's likelihood of developing sleep apnea, especially obstructive sleep apnea, which is the most common form. These risk factors include 1. Excess weight. Obesity is one of the most significant risk factors. Fat deposits around the upper airway can obstruct breathing. 2. Neck circumference. People with thicker necks may have narrower airways, increasing the risk of blockage. Age. Sleep apnea occurs more frequently in older adults, particularly after the age of 40. Gender. Men are more likely to develop sleep apnea than women. However, after menopause, the risk for women increases. Family history. A family history of sleep apnea can increase your risk. Genetic factors may influence the shape of your airway and the likelihood of upper airway obstruction. Some people inherit naturally narrow airways, which can increase the risk of sleep apnea. Enlarged tonsils or adenoids can also block the airway, especially in children. Smokers are 3 times more likely to develop obstructive sleep apnea than non-smokers. Smoking can increase inflammation and fluid retention in the upper airway. These substances relax the muscles in your throat, which can worsen obstructive sleep apnea by increasing the chance of airway collapse during sleep. Chronic nasal congestion. If you have difficulty breathing through your nose, either due to an anatomical problem or allergies, you're more likely to develop sleep apnea. Certain health conditions are linked to a higher risk of sleep apnea, such as hypertension or high blood pressure, type 2 diabetes, heart disease, stroke, polycystic ovary syndrome, also known as PCOS, and chronic lung diseases like asthma or COPD. Sleeping on your back can increase the risk of airway obstruction, which may exacerbate sleep apnea symptoms. Enlarged tonsils or a large tongue can obstruct the airway, especially when lying down. If you or someone you know has multiple risk factors for sleep apnea, it's essential to consult with a healthcare provider to explore testing and potential treatment options, such as continuous positive airway pressure, or CPAP, therapy, lifestyle changes, or surgery.